Good morning, good afternoon, and good evening, wherever you are on this planet. And really a very warm welcome from the organizers to this webinar today. As you can see from the lineup, we have an extremely exciting lineup of speakers and a program that I hope all of you will truly benefit from and enjoy. So first of all, I'm going to start off by giving you some objectives for this I'm not sure if somebody is sharing the screen and the slide deck. So if we can have the objectives of this particular webinar, please. And basically, as you know from the title, the main objective of this particular workshop is to look at and explore digital learning solutions for strengthening health systems. COVID-19 has presented many challenges for the entire population of this globe, but it has also presented us with many opportunities. And one of the opportunities it has presented is looking at scaling digital learning. And this is what this particular webinar is going to deal with. And I would like to thank the organizers, that is UCL, IRDR, and Empower School of Health, for putting together this webinar. Some of the questions that we're going to explore today are: what are the key components? What works? What are the challenges? And what are some of the examples that are being deployed? So these are the objectives as you see here. And before I begin to kick off with the agenda, some housekeeping announcements for everybody. Please make sure that your mics and your videos are turned off. Please ask questions by using the chat box and raising your hand. I hope that as many as you will participate as possible will participate in the polls. The polls means that you are not just passive participants, but active participants. Recordings will be available. Slide deck will be shared, so don't worry about taking copious notes. And also, we'd really like to have feedback from you, because for every webinar that we do, we really learn a lot from the participants. So please do that, and you will get a certificate of participation. So with those few words of introduction and housekeeping, I would like to say that the two people who are going to set the scene for this particular webinar are from the two main organizing organizations, and that is the Empower School of Health and UCL IRDR Center for Digital Health and Global Emergencies. So first off will be Professor Paul Lalwani. He is the director, founder, and the person who is behind not only the Empower School of Health, but also Empower. And if I begin to talk about all his achievements, we'll be here all evening, so I'm not going to do that. So Paul, the floor is yours to set the scene, and then we'll be followed by Patty after that.
Thank you very much, Bernadette. That's great. Could I have the next slide, please? Oh yeah, we were supposed to run a poll first, if we could do that. So if I could just ask everyone, if you look in front of you, there should be some questions on your screen. It's quick and easy. It'll take you just about a couple of minutes. If you could just answer these questions, it'll help us then adapt the presentation and our notes accordingly. So there's 7 questions in the first one. Do scroll down to see the other questions as well. Basically, we talk about your gender. We ask about your gender, your age, your geography, your academic background, the types of organizations you're working for, if you have any experience in taking digital learning courses, and if you are interested in setting up digital learning systems in your organization. So, quick 7 questions, multiple choice, and yes, no. Already 63% have completed it. All right. We're just coming up to 2 minutes. We'll stop it at 2 minutes. Okay, so we have, all right, we can stop the poll and share the results, please. All right, so as you can see, male, female, not quite 50-50, but not bad either. 2/3, 1/3. 30 to 40-year-olds are the major segment of visitors. The African continent represents 60%, Asia 26%. And we have some from, good to know, we have some from Europe, the Americas, Middle East, and we have Australia and the Pacific, one individual. Perfect. At least we have all geographies represented. Academic background, pharmacy and nursing are the major category, but several from management and commerce and medicine and dentistry. Type of organization, Ministry of Health, 1/3, UN and NGO, another 1/3 approximately. Some from private sector, that's great. Then we have academia and others. Have taken digital learning courses, 2/3, great. And many of you, I'm surprised to see this, but it's great. Almost all of you are interested in setting up digital learning and health systems. So you'll find this really interesting and useful. Fantastic. Okay, we can stop sharing. And could we go to the next slide, please? Just before we jump in, our moderator, while she's moderating, just to let you know, I've known Bernadette for more than a decade. She's an incredible professional and a human being, medical graduate from St. John's Medical College, a doctorate and a postdoctorate, research fellow at the Institute of Psychiatry, University of Oslo. President of the European Public Health Association for Migration and Health, and she's also part of the Lancet Commission on Migration and Health and has worked for various organizations. Bernadette, always a delight to have you with us. Thank you so much. Next. And you can skip me, I've already been introduced. Next. Okay, so very briefly, for those who don't know about Empower School of Health, next. Our areas of focus, leadership and change management, digital learning, and all of this we do within the domains of public health and procurement and supply chain. And you can see the various domain areas, but it's all under global health and supply chain. Next. So what brings us, what makes us unique is really bringing the skill sets of our e-learning technology capabilities on one side, where we've deployed our solutions across more than 100 countries in more than 20 languages. Our team that was previously just public health and global health folks are now a mix of management and leadership experts, public health, capacity building experts, digital learning and graphic design experts, and at the same time, instructional designers who support the entire process. So it's really bringing all of these groups together. And then the various types of organizations we've worked for. Next. So about setting the stage, capacity building needs, evolution of technology and challenges. Next, please. So many of you are familiar with the way WHO has represented this for the health system building blocks. And if we're trying to achieve universal health coverage, we absolutely need to make sure that the 6 building blocks are addressed, are present in any public health system. Within these, the 2 that we're going to focus on, which are directly relevant to what we are doing and where digital learning comes in, are health workforce and information. So we'll revisit this in a few minutes again. Next. So when we talk about health workforce, so the challenges of health workforce and information is that they are both continuously evolving and changing and are doing so rapidly. If we look at the required human resource capacity, so it's estimated that there are more than 100 million health workers in various ministries of health across the world. However, there's a massive vacancy gap where we need a lot more. In terms of from what's required to what's available, there's a 30 to 70% vacancy rate, but even more so in terms of effective human resource capacity is still significantly less because of lack of training and education. Can I just ask the person to click only when I ask, please? Okay, because it's animated. Now, in terms of, so we've got human resource capacity that's changing and evolving, and in terms of there are significant gaps. Policies continue to change and evolve, and in any particular year, there's at least a dozen policy changes or more happening at the global, national, and subnational levels as well. And then on top of that, we're introducing new technologies. We have new suppliers. We're moving from what we're doing today, what might be a basic, to mobile-based, technology-based, artificial intelligence, etc. So everything is changing on a rapid scale. Next. And this knowledge must be transferred into learning and action. So we need to take global knowledge, bring it into national knowledge and capacity, and create local capacity and action. Next. And these are for all kinds of health cadres, whether they're health leaders, managers, nurses, doctors, volunteers, anyone and everyone. Next. And we are taking people and the information and knowledge from the international level all the way down, national, regional, all the way to the patient and even user, if we are supposed to transfer knowledge effectively. And you'll hear about these examples from Japaigo as well. Next. But health organizations are not designed for knowledge management and learning. It's something that's desperately required, but it's not there. In many cases, in many countries, there's a lack of knowledge repository. There's a lack of process to identify, collate, and disseminate new information. Countries are not able to effectively inform, train, engage, and mobilize human resource staff. And often there's limited training budget, and the current approaches just are not scalable and sustainable. And regarding the financing and budgeting, we'll hear from at least 2 donor organizations today. So when we revisit the system, the health system building blocks, you can see that the health workforce and information, 2 of the key elements that we're addressing today, 2 of the 6 pillars, are not well addressed. And as a result, 2 of the 6 pillars are weakened. Next slide. So what are some potential solutions? What are organizations doing? What works in terms of digital learning? We're just talking about digital learning here and where it fits in. And that's what I wanted to do with these opening slides. Next, please. So back to Bernadette to introduce Patty, and over to you. Somebody may need to unmute Bernadette and Patty.
Thank you so much, Paul, for that setting the scene. And from Professor Paul Lelvani to Professor Patty Kostova. Patty is a person, and if we were sitting in a room, I would say, be careful, there's glass everywhere, because she's one of those people who has been shattering the glass ceiling, trying to build and work across 2 very challenging fields, the field of technology, IT, digital health, and public health in emergencies. And basically, she is a leading global researcher in this novel interdisciplinary domain. And as you can see on the screen, she has a lot of prestigious awards. And in particular, I would say that many of these work that she's been doing and her team at UCL is very pioneering. So with those few words, Patty, floor is yours to set the scene.
Can you see the screen? Lovely. So thank you ever so much for this fantastic introduction, Bernadette. And I'm really grateful for the invitation by Paul and for an excellent lineup of speakers, really challenging what we can do using digital technology and improving training and capacity building to improve global public health. So my work over the last couple of decades has been really centered around bridging the gap between the technological advances, which often stay in the industry settings, to actually enable and empower people who work on the ground, frontline healthcare workers, as well as members of public in digital public health. So I will just highlight a couple of major challenges and support them by case studies from our research at DPHE here at UCL to give you a glimpse of opportunities we all are working towards in 21st century. So to start with, we all have to understand how important, how indispensable mobile technology has become. Even a decade ago, the phone was just a communication means. Now they're becoming a device to empower professionals and public to seek information and manage their health. And it's not just the mobile technology. We also have to look into beyond the phones. IoT devices, so-called Internet of Things devices, can transmit information in real time, GPS enabled, from any kind of device which is connected to the internet. And these could be wearable devices, all sorts of sensors, all sorts of medical devices, which can immediately alert professionals that something is going wrong with their patient, which can keep members of public on the course of better management of their disease, or it can just contribute to sharing your results with your training and physical programs. The third important challenge we all are confronted with, and it has become apparent how important this field is media. Media are absolutely loving any health topics, especially the tabloid side of the media. And emergencies and pandemics and outbreaks and celebrities, these are the kind of mixture which actually hits the headlines. We have to understand this is our professional role as researchers and healthcare professionals to try to combat the misinformation and sensational information in tabloids. And sometimes, as you can see, it may even come from the highest ranking politicians who also are using media and social media to contribute to this avalanche of misinformation. So having set the scene, let's look at the challenges we all are facing or can make use of in the 21st century. So using media and social media is not just contributing to information or the misinformation in this field I have mentioned. It's also providing an amazing opportunity to tap into crowdsourced information for early warning. This film is actually taking us back to the previous pandemics, the swine flu, where my team has piloted a new approach using mining Twitter, at the time quite novel and not as widely used social media channel, to have early warning platform, highlighting the upcoming increase and spike in swine flu 2009, 2 to 3 weeks before the official data in the HPA agency in the UK and CDC in the US actually have known about the disease. So after the talk, if you're interested, I encourage you to watch this BMJ produced short film about the potential of social media for early warning. So just to highlight, this is the slide which demonstrates that we have known, obviously it was done retrospectively, from social media 2 to 3 weeks before, when the first spring spike in swine flu 2009 hit the UK and the US. This needs to be built into preparedness and early response. And there is still a long way to go, even though it's a year ago. The second challenge to discuss is using participatory surveillance. People with social media devices can actively contribute to reporting diseases and advising about their conditions. Tapping into participatory mobile surveillance and crowdsourcing is something which, again, has started to see the light of the day, but still is a challenge which has got a long way to go. As a case study, I'll just show you another project. We work in Brazil, where we developed a mobile app to support environmental and healthcare workers doing surveillance of mosquito-borne diseases in properties in Pernambuco and in Paraíba, where, as you know, mosquito-borne diseases are endemic, like Zika and chikungunya and dengue. And suddenly, as opposed to using paper-based traditional systems, they use mobile app where they can immediately transfer geolocated data about mosquito surveillance and occurrences, and their managers and public health experts in real time can see the map where the hotspots are and can immediately take a rapid action. Taking this approach further is not just tapping into the professional and public mobile participatory surveillance. We also need to bridge the human health world and the animal health world. So the One Health approach is the framework to invest in the future, where we really combine all the data sources from traditional surveillance, from participatory mobile surveillance, and also from the animal surveillance world, and really bring it all together to be able to predict and prevent and rapidly respond to any upcoming emergencies and disasters. The third challenge I would just mention here, setting the scene, is the education. That links back to the excellent introduction Paul has given at the beginning. Well, we have to revolutionize the way we educate both citizens and professionals. So in challenge 3, I'll show you a couple of projects where we have deployed mobile technology to provide public health education for children and for adults. So this project is called EBUG, EduGames for All. And it was a highly rated European initiative in 10 and over the time 25 countries in Europe, developing an educational game-based learning for children in primary and secondary school to have the kids understand through an enjoyable game learning what are the microbes and bugs which make us ill and how to protect themselves and how to understand concepts like antibiotic resistance. It's not just children who play games and who can use mobile technology to improve their public health knowledge. Our most challenging and from my perspective, gratifying project was Mantra. And we used a game-based technology to develop an educational resource for women in rural Nepal around maternal neonatal health and improve their understanding of health-seeking behavior in the most deprived parts of Nepal. We work with an amazing NGO in Kathmandu, HERT, who put us in touch with women in rural Nepal. Many of them were very low literacy or illiterate. Some of them have never used a smartphone before. It was amazing to see people who didn't know how to use touchscreen to become familiar with the technology in a couple of minutes and really enjoyed playing the game, developed co-authored with them, so anything was communicated through locally approved pictograms and images. So it's not just children, it's also members of public in the most deprived part of the world who can improve their education and their understanding of health through mobile technology. Well, and of course, training is mainly about professionals. Professional workforce, from nursing staff, clinical staff, microbiologists, surgeons, they all need to be constantly kept on top of the knowledge. And mobile technology can give them the tool to remain on top of their discipline. So as a case study, we have developed an award-winning project called GASDA in Nigeria, and now we are piloting it in the UK and planning to scale it up across Africa. Addressing the most important issue of today, or one of the most important issues of the day, is antibiotic resistance. So through limiting prescribing and increasing compliance with WHO and Stanford guidelines, the Mantra persuasive decision support tool has improved prescription decision at the point of care. So assessing the prescription decision for surgical prophylaxis, the app has given the surgeon a feedback, and the feedback would be positive or negative. So it is in compliance or it is not in compliance, encouraging them to change their behavior at the point of care. This is the first project demonstrating a behavior change intervention at the point of care, improving antibiotic prescribing. Well, and the final challenge is going beyond the technology itself. It's looking at the data, access to data, data ownership and sharing. And this is a massively important ethical realm where we all have to understand that the data has become the kind of oil of 21st century. This is one of the most important commodities where a few Silicon Valley-based companies are making zillions of dollars profit, while millions of people around the globe who are using those tools, using social media apps or any kind of digital interventions are contributing their data to and have no stake and no decision in the process. So looking at how we actually rebalance and how we legally develop frameworks and regulatory mechanisms to allow people to have more of a choice and decision about how they share their data, and also empower public health agencies in better sharing of the data with industry and with research organizations. That's a really important ethical regulatory question of today. So to wrap up, there was an introduction of my center, DPHE, at the beginning, but we have been successful in having a number of prizes and TV coverage around the spectrum of our projects. Some of them mentioned today. And if you're interested more about the DPHE, you're most welcome to contact us on this email address or visit our website. Thank you ever so much for joining me today for the introduction, setting the scene. And I will hand over back to Bernadette.
Thank you so much, Patty. I think that was really informative and you packed in everything that you could in your time slot, and the slides will be available to all the participants. So I'm very glad for that. And with that, we move rapidly to our keynote speaker. And our keynote speaker today is a senior civil servant, both at the national and international level, and a statesman and a veteran in the field of health, public health, global health. So it is my great pleasure to introduce Dr. JVR Prasad Rao, who has been former Secretary of Health, Director of NACO. He's also been Special Envoy to the UN Secretary General, and his area has been in the area of health, public health, HIV, policy making, as well as taking the agenda forward, including now working with several organizations in India and currently involved in the COVID-19 response as a member of the National Task Force of ICMR and the Global Advisory Group for COVID-19 with the state government of West Bengal. So with those few words of introduction, the floor is yours for our keynote address, Dr. Prasad Rao.
Thank you very much, and good evening. I would like to basically give an overview of the entire problem in the from the government and UN side on a broad brush. If you look at health as an important social sector, it interfaces with many related development sectors of a country in what we call the economic, social, and cultural determinants. Because of this interrelationship and the services that need to be provided to people at large, it is highly HR intensive and multidisciplinary. Developing the capacity and constantly enhancing it to meet the changing requirements of the health system is a growing challenge for health planners and administrators and policymakers. Globally, we are witnessing an extremely complex scenario of the health system coming under intense pressure from three important directions. One is the impact of repeated onslaughts of communicable diseases. The latest one is COVID-19, but last 20 years we have seen as many as 4 or 5 of them coming one after another. Second is the increasing incidence of natural and man-made disasters, drawing precious resources away from the more deserving beneficiaries of the health system. It is also happening time and again. And third, and most important, is the environment and its constant degradation, posing new and unforeseen challenges, completely unknown. Because of these mutually reinforcing factors, the capacity of the health system functionaries is increasingly put to test, and their skills are getting fast out of date soon after they are imparted. It is not just technological obsolescence that we are facing, but human resource obsolescence that we face today in the health sector. It is not just capacity building, but constant enhancement and updation that is more relevant in today's context. But an overarching area of concern, which I feel is very important, is equity in providing health services to ensure that no one is left behind, that services are reached to the last mile. The UN Sustainable Development Goals lay great stress on no one getting left behind. But the health system has time and again been looked at as a perpetrator of inequity, unfortunately, stigmatizing the very people whom it is supposed to cater to. We have seen evidence of this earlier in HIV/AIDS. We are now seeing evidence of this in the COVID-19 outbreak and response, and denial of the services to the most needy. In this background, if we look at the training and capacity building programs we have today in developing countries, we find that they are still carried out in the conventional methodology of classroom pedagogy and textbook orientation. But the needs are new and constantly changing, and equitable access to services and reaching them to the last mile hardly figure as a priority issue. You find they don't really figure in the training programs that much. So the mismatch between the two is causing intense pressure on the health system like never before. And the COVID-19 epidemic has exposed these deficiencies in the most telling manner. This pandemic is a combination of an epidemic and a natural disaster. But people are trained for either one or the other. For example, the police personnel who are used to control the quarantine, etc., they are more trained to handle natural disasters and not outbreaks of epidemics. So we find them at a loss on how to handle quarantine and screening issues. Healthcare personnel also are new to follow infection control measures like keeping PPEs on for a long time while working in the hospitals and with communities. All this leads us to think about building capacities from a new lens. The enhancement needs to be faster, more innovative, and resilient to adapt to the needs of the situation. Both governments and the UN, which have to handle public health emergencies and natural disasters, I think they need to adopt new strategies for capacity enhancement. This is where digital learning comes in handy. Using digital technologies for training and building capacities has not come all of a sudden. It has been there for some time, but COVID-19 has forced us to put it on fast track. It is important to use this challenge as an opportunity and bring in digitization much faster into the learning process for the functionaries in the health system. In this context, I feel this webinar is very topical. We will keenly look forward to various experts speaking on the role of digital technologies in global health and in emergencies. Thank you very much.
Thank you very much, Dr. Rao. That was a very clear, concrete, and crisp message regarding the current situation and also all your past experience. So we greatly appreciate that. There will be time to ask Dr. Rao questions during the Q&A session. So we will move on now to the panel. And if I can have the next slide to introduce the panel. That we have put together a very complementary panel of people who are very senior in their positions, as well as have long-standing experience in their particular areas and their fields. So what they're going to do is they're going to talk about not only what the challenges are, and what are the problems? Because a lot of us know that, and Dr. Rao also alluded to some of the current challenges, but what are some of the potential solutions? What have organizations been doing? What works and what doesn't work? And our first speaker, can I have the next slide, please? Is, and I hope that we have Renee with us. And Renee, are you there?
Yes, I am, Bernadette. Can you hear me?
Yes, excellent. So it gives me great pleasure to introduce Renee Christensen, who leads the capacity building and training program at the World Health Organization. And I think this is the time where capacity building and capacities within the health system have really been challenged to the utmost. So Renee, the floor is yours to share with us your experiences.
Thank you very much, Bernadette. Thank you. So today, good afternoon, everyone. Good morning, depending upon where you are in the world. I'm joining you from Geneva, Switzerland, and I'll be talking a little bit about what we're doing for capacity building and training at the Global Outbreak Alert and Response Network. That's who I work with. I'm based at WHO in Geneva, and also some of the work we're doing with our colleagues at WHO. Next slide, please. So for those of you who aren't familiar with GORN, we are a network of over 250 technical public health institutions that work together to coordinate response to public health emergencies and outbreaks. So I'm part of the core operational support team, and we work with partners to help bring the technical expertise that's required when a public health emergency takes place. We've learned, we've been in existence for about 20 years, and we've learned that not one single institution has the technical expertise and capacity that is required for an outbreak response. It's a multidisciplinary approach. So we have worked with our partners. We have established the GORN Capacity Building and Training Network. We have about 40 active partners from all parts of the world to build a competency-based capacity building and training program. And the purpose of this program was not to train people on the technical skills. We work with the technical specialists themselves. It's to build the skills required and the competencies to adapt and apply these technical skills in a field environment. Outbreaks are dynamic. They are stressful. People that we're bringing in to support work in these situations, often working in low resource settings, in highly insecure environments, and in really, really different settings to what they're used to working in back at their home institutions in their home countries. So together with our key partners, we have many partners, but our key partners are US CDC, the field epidemiology training programs, big universities, UN agencies, MSF, IFRC, etc. We have built this three-tiered program. The first tier is the mandatory training that's required before anyone deploys into the field. And it's comprised of a series of self-directed e-courses on various topics that are listed on the screen. And we also run short classroom-based workshops where we bring in former deployees to share their experiences, to really talk about the realities and the challenges of what is really involved in working in an outbreak response. And we have, in our second tier, it's an outbreak response scenario-driven simulation exercise. That's a face-to-face learning opportunity, but it is digitally driven. And our third tier is advanced leadership training, which is looking at the individual and collective leadership and crisis management skills, specifically for senior outbreak responders. And that's a blended learning approach. Next slide, please. So COVID has changed how we work. The number of challenges that have come up, not only for how we can send people from one part of the world to the other with all the travel restrictions in place and the quarantines, it's also changed how we learn and how we educate. At the moment, we're unable to bring people together into a face-to-face classroom environment for the most part. So again, we've worked with our partners and we've tried to adapt and scale up using the digital opportunities that are in existence. So starting at the top left of the screen, we've been working with partners to create new priority courses. So these are self-directed e-courses They are hosted on the GORN learning management system, which is targeted to GORN partners, but it is open access. Everyone can just create an account and you'll be accepted and you can access everything there. We have been trying to address the key gaps at the moment that our partners are facing. One of the biggest issues has actually been around the area of contact tracing, and we've been developing a range of materials that have been designed in a way to be suitable for people working in different parts of the world in different operating contexts. We've been translating the content that we have already had in existence and of course translating the courses that we're currently building. These are generally for the moment into the UN languages in addition to Portuguese as well. And we're working with Translators Without Borders as well to try and adapt and translate into local languages where possible. We've been scaling up the delivery of virtual facilitated workshops. And this has allowed us obviously to deliver workshops every day rather than only once every couple of weeks if we're traveling around the world. And we've been working again with our partners to make sure we have enough capacity to coordinate these courses, to set them up using the technology and to facilitate them effectively as well. Going up to the top right-hand corner of the screen now, looking at a slightly different aspect, we have been working with some of the leaders in mobile learning and gamification as well. We've been supporting a company called Endemic. You might be familiar with the game Plague Inc. It's a mobile application game that is actually has over 6 million users at the moment. It's the single most downloaded game in the world. And the purpose of that game is to actually try and wipe out humanity by making a plague spread. This game's been around for some time. At the start of this year, we spoke with the Plague Inc. developers about the idea of creating a scenario where people had to actually apply public health interventions in order to stop the outbreak across all of these different public health disciplines. They actually just launched the game last week. It's called The Cure, and so far it's receiving very good feedback. So while it is a game, there is a lot of really important learning that's coming out of that as well. We are working again with some partners to transform our simulation-based trainings. This is our flagship training program that uses, actually, it's a game in itself that's used in the scenario and turning that into an online serious game, exploring the inclusion of virtual reality, augmented reality, and mixed reality as well. We're also working with partners to utilize existing digital platforms to enhance coordination. So there are so many organizations and so many new trainings and capacity programs being developed, but we need to make sure that we're complementing each other and we're not duplicating and wasting resources and time. So we're using various platforms, MS Teams, all those sort of things as well, to make sure we're staying in touch and we're sharing resources. GORN have also established the COVID-19 Knowledge Hub, which is a public-facing site that is a curated list of all of the available worldwide, not just WHO, all of the partner key resources, guidelines, toolkits, every webinar that we hear about. There's a sub-hub specifically on capacity building and training as well. So, and you can filter according to your public health specialty, so infection control, epidemiology, etc. as well. And that's updated on a daily basis. If I can go to the next slide, please. Now looking at WHO, so WHO have just launched a new roadmap in the attempt to strengthen country level surveillance through enhanced digital systems. So the team working on this have recognized that there are limited digital skills for the health workforce and a low uptake and utilization of digital health services. So they have developed a roadmap you can see on the screen, and they are working on specific activities in order to build this digital capacity. So they've developed a competency-based framework for the digital health workforce to strengthen these knowledge and skills and the application ability, and are developing a series of digital training courses on the way to govern the use of these digital systems and also how to actually be the one implementing them yourself. And they've actually just launched their first course and it's available on the WHO website. Next slide, please. So you may be familiar with this platform. This has been set up by the WHO Health Emergencies Program called Open WHO. And this is a MOOC-style platform that hosts PowerPoints and video lectures on various topics. Since COVID began, this platform has exploded. It's become one of the primary means for sharing up-to-date information on the guidance and the recommendations for COVID response across disciplines. It's available, courses are available in 43 languages and approximately 4.6 million users. They were just actually, the team was just awarded yesterday the Gold Award for digital learning as well by Digital Technologies. So it's become quite prominent. Next and the final slide, please. So another team, WHO, called the WHO Academy, which is a new initiative that started a couple of years ago, which is intending to revolutionize lifelong learning in health. So this is for WHO staff, as well as the global public health workforce. At the heart of this is going to be a learning experience platform, which is going to be using artificial intelligence and machine learning with the idea of putting learning in the hands of the learner themselves. So the technology will be smart enough to be able to present the learning opportunities that they think the learner who is using the platform is most in need of. They also created a mobile learning app for COVID-19 specifically, which serves as a single entry point into all of this WHO guidance tools and training resources as well. And select GORN partner resources are also available through that app. Through this app, we're also really proud to announce that we've actually been involved in the development of the first WHO interactive augmented reality course. And this is been designed for healthcare workers to learn the proper techniques of putting on and taking off PPE, as depicted in the screen. Thank you very much, Bernadette.
Thank you so much, Renee. And I'd like to say a very big congratulations to you and your team for the prize, which I'm sure is well-deserved, as we've seen from your insightful talk. Thank you for that. And the participants will be given the talk, so they'll be able to get back to you. And I'm sure there'll be some questions in the Q&A. Thank you. And then moving quickly on to Dr. Ruben Somikan, and he is no lightweight in his sector, having over 30 years of experience and working and managing large funding for public health programs in India. And he's the division chief of the tuberculosis infectious disease team at USAID India. So without much ado, Dr. Ruben, the floor is yours.
Thank you, Bernadette, and good day to everyone from wherever and whichever part of the world you're in. It's been awesome so far, and I've enjoyed every speaker. I hope you have too. I would just like to touch on a few points in addition to what the other speakers have spoken about, to really try and understand what it is that the challenges that are being faced by implementers and what it is that you need to do to be able to get to the masses. I'll not cover much, but I'll try and cover as much as I can. And one of my favorite quotes is by Carl Sagan, the world famous astronomer, author and professor and many other things, was how he depicted how a sunbeam is really. He said his favorite color is a pale blue dot suspended in a sunbeam. And if you translate that into what we are seeing in learning, really in the whole sunlight or the whole plethora of learning that's available, digital learning is a small pale blue dot. And we now need to take it to scale and really ensure that it shines on everyone who needs it. And what we really look at is, how do we cover this and how do we provide support to the people who need it. Next slide, please. So I'll just speak on a couple of points on what the challenges, needs, and some of the tried and tested solutions. And I'll keep it simple because I want everyone to have a take-home message in this. At last count, globally, there are 7.8 billion people. 7.8 billion people. And we also know that the day you stop learning is the day that you're no more alive. So everyone needs to learn every single day. We are constantly bombarded by the television, by social media, by the newspaper, with all sorts of information. but are we really capturing information that's useful to us? So some of the points that I'd like to stress on firstly is, whenever we are trying to share messages, one is keep it simple. It tends to be overcrowded, too many messages, and then the whole message is lost. So we use something called the SOCO. It's a single overriding communication objective. You say it in the beginning, you say it in the middle, and you say it in the end. But it's a single message that you want the individuals to take home. Try it sometime. You'll kind of find it interesting, and you'll find that the audience with whom you're working with will really take home a message that they can find useful. Secondly, moving pictures. Not many of us have been to the theaters in the recent past, but I'm sure we all love to see films. And I'm sure many of you all are watching movies in the pleasure of sitting at home. So why do we watch movies, and what captures our imagination and our attention? And for every movie that you've seen, if you think back, what is it that you remember of that movie? I'm sure there are a couple of scenes that really captured your imagination, that wanted you to be engrossed in that particular film that you're seeing. So how do you translate that into something for learning? And really, we don't see as much as we should in learning through moving pictures or through film. Yes, we see a lot of advocacy materials and things like that, but not much that's capturing the imagination for attention. So another challenge is, how do we do that, and how do we ensure that that happens? And when you have stills, so for example, infographics, you have a small space, every word counts, every picture tells a story. Everyone knows that. So how can you capture the imagination of someone who's looking at the infographic? I think that's crucial. Handheld devices, a lot has been spoken about it, and I'm very impressed by Professor Koskova's take on how to use social media. Social media, again, it's exploding. I just checked the net before this presentation started. Of the 7.8 billion people, 5.2 billion have access to a mobile phone. So that means there's 5.2 billion people who can learn. Now, are you getting the message across to you? Social media certainly does. It's not covering all the 5.2 billion, but it's covering a large population. So are we having adequate social media messages that we can use in a handheld device that people can take home? The pandemic has taught us, yes, how to wash your hands, how to mask yourself up. All those things are what we have been sharing through social media to enable social behavioral change. And that's crucial, everything that we need to do. Also, in the cloud, there is unlimited storage in most cases, and that enables you to access topics of interest. So how can you ensure that you get the topic of your interest, or is it a large group of people that you want to share it with? Remember that learning needs to happen en masse. Individual learning is fine, but it's not going to change the paradigm on the ground. Everybody who's working on the ground needs to change with the times. They need to upgrade their knowledge. And really, these are some of the solutions that we can look to. And I'll just stop with one example that we have from Empower Health itself, whom we are working with in India to scale up digital learning for tuberculosis amongst the various cadres that Paul spoke about when he began this presentation. And so we're going to share that, I know once we have some amount of data available on how you can quickly scale learning and how that learning actually transforms change on the ground, which is what you really want to see. And to me, that's what's going to be crucial. It's not learning for learning's sake, but learning to create change. That's what we should be looking for. Last slide, please. So I just want to say, you can only change your world through digital learning, and it's crucial that you use every single opportunity that's available. A number of options have been provided through the earlier speakers, and challenge yourself, because only then can we bring about a change in this world. Thank you. Back to you, Bernadette.
Thank you so much, Dr. Rubin. That was very, very clear. And I think in a way, you practiced what you preached in your first slide by trying to give us simple messages, at the same time emphasizing that digital learning is here to stay, and we have to take it forward. And how we take it forward is really going to determine our tomorrow. So thank you very much for those insights. And now moving on to our next speaker. And our next speaker is Dr. Igor Olinik. I'm sorry if I'm mispronouncing your name, but excuse me for that. He's a specialist in global partnerships and in particular also in health diplomacy. He has been working and currently works in Geneva with specialists as a specialist in partnership with the Global Fund to fight AIDS, tuberculosis, HIV, and also looks at health systems and health governance. So, Dr. Igor, the floor is yours.
Yes, good afternoon, good morning, good evening, dear participants. So first of all, I'd like to thank to Paul Alvani and his team for organizing this interesting webinar. I also would like to thank to the keynote speakers and distinguished panelists, because I already learned a lot digitally in the last 30 minutes from you. So if the first question I had about the digital learning, so how big is the issue? And I asked myself, so I did a very simple search in Google, and very simplistic, I would say, search in Google, and it's already showed almost 2.3 million of results. So it is big already. And the second question would be, can we go to the second slide? Would it substitute traditional way of learning, traditional way of capacity building? Like, would be sitting in a classroom, will continue? Will it be the same reality as always? Or you can see in the picture below, global health, global north experts boarding on plane to go to support countries to develop or design their health program. And do we still need to do this? Do we still need to have these parachuting experts from global north, or we need to completely switch into the kind of new virtual world of learning, capacity building? I think probably we need both. But what's interesting, in the COVID, when COVID pandemic hit the world, and particularly the Europe, quite hard in mid-March 2020. This is the time when countries start to lock down. So many experts who've been working in countries had to be retrieved, evacuated. So did it cause a collapse of trainings? Did it cause a collapse of capacity building programs at countries? Not at all. Just to remind that this year was a very critical year for the Global Fund partners and recipient countries, because this is a year where most of countries were putting their funding requests, and the cost value was $14 billion. And we had some fears at the beginning that this lockdown situation, when country had abruptly stopped getting support from incoming consultants, it will bring some challenges in getting quality funding requests in time. So, but not at all. Again, this challenge immediately gets some solutions. So we talked to our partners, so our technical partners, WHO, UNAIDS, Stop TB, Rollback Malaria. Our bilateral partners like US government, expertise, French initiative, German technical cooperation, they immediately switch and reoriented towards a distance learning. And actually, I like the way Dr. Prasada Rao mentioned at the beginning. So these technologies, they exist before, but it's already put them very quickly on the fast track. So, and yes, partners and we had a lot of webinars. We start to use technologies probably in a more streamlined way, such as Zoom, BlueJeans, Microsoft Teams, Skype, etc., all type of applications. And as a result, we received quality funding requests timely, so there were no slippages, there were no delays with the submission. So this was very, very powerful proof, I think. And let me just share with you feedback that we received from one of the partners who are providing countries with this remote support. So they said that digitalized support can be as effective or even more. In the past, experts had to travel to country and basically they've been booked by countries on the basis first came, first serve. So now using technologies, webinar, video conferences, and more kind of a smart planning. So one expert, one top-notch expert could support 3-4 countries simultaneously. And it brings down the cost, of course, and improve outcomes. Next slide, please. Also, this digital learning approach is very high on the Global Fund agenda. So we use it very intensively. So we have iLearn platform through which we have access to large number of trainings. So including internal training on our policies, on new guidance, or also there is access to external training. So you can plan your own capacity building, your own competence building as you want. So at your own pace, and I think that's very important part of continuous education at work. Perhaps we can go to the next slide. Again, this kind of a digitalization of communication and relationship with partners using some online platforms, it's created for us a new opportunity. So we jointly with partners, we develop a capacity building tool that basically called partner support platform that allowed countries to raise and to channel their requests for TA, for capacity building through online system. So for example, if country failed to identify technical assistance provider at country level, so they can raise this request through the system, through our country team, through fund portfolio manager. And then this request automatically will go to a full range of our partners. So WHO, UNAIDS, Stop TB, bilateral partners, they immediately will see the request coming from country, and they would be able to then communicate directly with the country and offer their support. So I think, again, that's kind of digital learning, digital capacity building. It's probably won't substitute the traditional way of doing things, but I think it's a very interesting approach that will be developing further. So I think it's now put on the fast track, and I think it's really important conversations that we are having today. Thank you.
Thank you so much, Dr. Ugur, for sharing your experience. And it's very good to see that the Global Fund platform is active, and it's something not theoretical, but in practice. And we'll come back, I'm sure, with some questions in the Q&A section about what are the other issues related to this digital learning. Thank you so much. And we move on to our last speaker, but not the least in the panel. And it gives me great pleasure to introduce Dr. Bulbul Sood, who has more than 45 years experience as a public health professional, professor of preventive and social medicine. She has been the co-chairperson of the White Ribbon Alliance with Safe Motherhood in India. She has worked untiringly with the Indian Nursing Council, Government of India at national and state level, and she is currently the country director of JPIGO. So Dr. Bulbul Sood, the floor is yours.
Thank you very much, Bernadette, and good morning, good afternoon, good evening, everyone. Thank you very much for the organizers for giving me the opportunity to share the work. Jhpiego is an affiliate of Johns Hopkins University, and I'll try to share some of our work which we did during the last 6-7 months on capacity building of the healthcare providers of different states that we have been working in. Next, please. So when the pandemic started by mid-March, there was a complete lockdown in India, and we realized that there were a lot of misinformation about the COVID, how to prevent it, how to use social distancing, to wear mask or not to wear mask. And so my team very quickly started working on developing the material, and every day we were having new guidelines, but it was difficult for people at the grassroots level to understand what they had to do. So as I said, we developed the material and used the hub and spoke model to train workers, especially the field level worker, which included the ASHAs, the ANMs, the Anganwadi workers, the community health officers, counselors, and I'm happy to say very quickly using digital technology, we were able to train more than 54,000 workers in 13 states across the country. And again, this was not just one-time training, but we also had, using the WhatsApp group and e-mentoring to give clarification and, doubts which was there in the minds of the workers. And this is how, we were very quickly able to improve the services at the grassroots level worker. Next, please. But we also realized that, one time, just training is not going to help. So we are now actually working on the online learning management system, which is going to be empowering the community health officers. And I'm happy to say with the USAID support to the Emergency Relief Fund, we were able to initiate this work in 12 states, and our plan is to almost, reach out to more than 8,000 community health officers. This will be done through, developing the material, which the trainees then use at their own convenience, anytime. And of course, it's also will be not only effective time management, but also will be reducing the cost. And as I said, it's capturing the learning outcomes and linking them to the enhanced system preparedness and, continuous learning processes. Next, please. We also, some of you might be aware that US government donated 200 ventilators to the government of India. And we were fortunate that they asked Jhpiego to provide technical assistance to also standardize the intensive care of severely ill COVID-19 patients. And as you can see from the map, this covered almost 29 facilities across the country. And with the lockdown and with no movement, it was not possible for my team to go to any place. But what we did, that we used a hub and spoke model, and again, using digital technology, created this ecosystem around standardizing and giving severely ill COVID patients how to manage them. So we started what we call the virtual grand rounds, e-grand round, which is done every 2 weeks, capacity building, of course, of the critical care providers, doctors, nurses, lab technicians, and others, remote mentoring and monitoring. And of course, all this material was developed, standard operating procedures, and this was shared. And so this is a continuous process, and I'm seeing every day, when we have the grand round, almost I find 300, 400, healthcare workers are connected, and this is making a lot of difference. And, as I said, standardizing the care. Next. Next, please. We also had a program where we were working in assuring quality of care in the private sector, and the facilities which were providing maternity care, and this program called Manyata. We worked with the Federation of OB/GYN in the country. And this was earlier done, where you would register the clients, and then of course, but with the COVID, again, because of the lockdown, everything was made digitalized. So, there's a paperless registration or the digital payment, whether it was, digital training and mentoring, and also, in fact, quality certification. And I'm happy to say that now with the government of Maharashtra, the quality certification is being done digitally, and sensitization and quality improvement trainings are happening all digitally. Next, please. Next, please. So I think some of the challenges and way forward, and as I said, and all the previous speakers have also said that this COVID-19 gave us opportunity to really fast track use of digital technology, and we are learning as, we are building the ship, but there are also several challenges that we are, seeing already, and also we are, thinking, how we have to do it way forward. So one, of course, is the limited opportunity for interaction, and some of the solutions which we are thinking is having small and frequent online lectures to be arranged, dedicating enough time for the learners and for them to sort of imbibe what we've been teaching. Connectivity issue is there, especially in the rural areas. So we have been also recording the lectures, and then the offline viewing can be shared. And again, we have found this to be very effective. Low attention span is another thing which we have noticed, and we have been thinking of, and in fact, others also would have done that, you have now some online software which provide option for creating virtual rooms, and you can, go and huddle and, do certain activities. The questionnaire, was done at the beginning of this webinar, and engaging and having more engaging discussion with the participants. Skill demonstration again can be also done, and we have gamification and videos, and managing this large group. So I think going forward there are some challenges which are coming up, but we have to find solutions also. So I'll stop here. Thank you very much.
Thank you so much, Bulbul. And I think it's very important that we have learned from you some of the way, not only the challenges, but how you have dealt with them. And I think that will be an important take home for a lot of the participants here. So first of all, while I'm a great advocate for everything digital, one of the big challenges when we have these kind of meetings is the applause. So a big round of applause to all our speakers today. It's been a really very, very rich and interesting discussion so far that we've heard from the speakers. And now I would encourage everybody to put their questions in the chat. I will read out the first question that we have on the chat. And the first question comes from Anita Kalima. And Anita says, digital learning is good and coming at the right time. However, many developing countries are lagging behind in terms of making sure that there are right infrastructures in place. The question to the panelists is, how can we address this challenge within limited financial means? And I would like to add a question to this and perhaps ask Dr. Rao to address this question at the outset is, how do we get our policymakers to prioritize this? Because if the policymakers prioritize the area, then maybe the financial issues will be resolved. So Dr. Rao, if you would answer that question, please.
Yeah, thank you. I think financial issues always follow political decisions. If the politicians are and the policy makers are convinced, then finances automatically flow. So I think your question as to how can we make the political leaders see the challenge and provide resources for these programs, that is the issue. But I think thanks to this particular epidemic and the economic devastation that it has caused, I think the policymakers have now realized that health is an issue which cannot be pushed under the carpet anymore. I hope this stays on with them, because generally people are known for short memories in the area of policy making, but hopefully this will stay. Because earlier epidemics, what they did was, they have caused limited damage in terms of the longevity of the people or the health status of the people, etc. But what COVID has done is they have shaken the economies of countries. So I think investing in public health is now no more an option, it is a necessity. I think that is realized more and more. And with that comes resources, and with resources comes all the other things that you are speaking about. I feel that we are into a new normal now. And the old normal, I don't think can be restored. I mean, people who are dreaming of going back to the old normal, I think it's not going to happen. So we hope this is the new normal that we are going to get, where health will be the king, public health will be the priority, and we'll be able to see more resources flowing into health. Thank you.
Thank you so much, Dr. Rao. And I think that will be one of the quotes of this evening, that public health and health is not just, it's become a necessity, and it's not something we can ignore. So thank you for that take home. The next two questions, I think, Renee, you've got the jackpot. Both the questions are for you. And the questions for Renee are as follows. I'm just trying to get the questions. There are two questions to you. One is from Lakshmi Bhattarai from Nepal. And Lakshmi's question is, as the need of digital learning is soaring in the pandemic situation, and it is very effective and secure to disseminate the knowledge information, my question is how to reach needy people who lack access to technology in a country like Nepal. That's for Renee. And then Dean Batuma also has a question for Renee, and the question is about equitable access to training. How does digital learning work in countries that do not have adequate internet, electricity, and technology? So over to you, Renee, to answer those questions, please.
Thank you so much. Really, really important questions, and they're not without their challenges. So as many of our speakers have mentioned, well, the majority of the world's population have access to a smartphone. So mobile learning is definitely one avenue that there is a lot of investment in for very good reason. So the courses that we develop and the systems that we host them on are, where possible, they are available and accessible via mobile phones. And for example, the Open WHO platform, if you are in a low bandwidth area, the video lectures that they have, you don't have to watch the video. You can simply get little snapshots of the images of the content on the screen, and you can make your way through them. For other courses that we have on the GORN learning management system that are more interactive courses that do require some internet access at the time, they're not available offline. We have high bandwidth and low bandwidth versions. So where possible, we are trying to cater to all the different audiences that we can, given the environments that people are working in. Another avenue we are exploring at the moment is to, where possible, we make access to the low bandwidth, self-directed learning opportunities on a mobile phone, noting that there are limitations with how much impact can come from that learning. It's a fantastic way of getting information out there to a really large audience, but for some skills and competencies that we're trying to build, that does need to be followed up with some more interactive learning opportunities. So if there is a possibility to use a virtual facilitated platform, even just over telephone, doesn't have to be on internet, it can still be by some older school means as well, we can do that. We've also worked in places. I did a lot of work in South Sudan a few years ago, and we were working in areas that didn't have cellular service. So we would bring people who worked in those areas down to an area that we could train them either virtually or face-to-face, really in depth and detail, and then they would return back out to those areas and offer the face-to-face learning that could complement the other virtual means as well. So there's different options, but this is something that I refer to our previous speaker. The policy and the infrastructure is something that I think really needs investment, and I think we're all learning from COVID that this is something that hopefully the world gets behind. Thank you.
Thank you so much, Renee. And now there's a question from Raymond Okechukwu. And Raymond's question is, are there global framework on governance and accreditation of institutes that offer digital learning certifications? Raymond, Professor Paul Lalvani's brief introduction to this after the Q&A, will address this. So I'm going to leave it to him to address it in his presentation. The next question is from Barhane Meskil Acheba, and he is asking, his question is about, are there short-term training on how to conduct digital learning? What is your assessment on extent of awareness creation on the tools used in digital learning? And since the next question is from Stephen Kayambade for the Global Fund, I would first request Igor to answer both these questions. Can the donor, such as Global Fund, champion this cause and have it as a must for all their recipients? So Igor, would you like to take those two questions, please?
Yes, sure. I mean, first of all, I'd like to start with the second question about how can the donor, like Global Fund, champion this cause. I think we are doing this already. So Global Fund is a partnership. So what we do is we fund, together with our partners, technical and financial partners, we support national programs. And it means that if approach to digital learning, digital capacity building is included into the national health program, particularly for HIV, TB, malaria, so if there is then policies and if there is an alignment among country stakeholders that this is the way we would like to do things and this is the way we would like to learn, we would be more than happy to support this. I think it's again, this is a question how we, and yes, and in addition, we also support a lot of innovative and pilot projects. So, but of course, this would be much more powerful request if it comes through the national policies, through the funding request. And we clearly see that this is an integral part of national TB program, for example, or national malaria program. And in addition, of course, as a partnership, we leverage our partners like Expertise France, German Technical Cooperation, US, WHO, UNAIDS to work together with the countries on this initiative. But demand should come from country level.
Thank you very much, Igor. There is a comment from M. Hemnet Kishima, and one of the comments is one of the challenges some countries have is the lack of internet and electricity, which is a problem for digital learning. And if I could just also take the next question, and the next question is from Dr. Nirmala Chatterjee, and that is whether the amateur radio tracking is helpful for the digitalization of public health training. So these questions, and there's another question as well for Renee, which is expecting to see data analytics course and GIS mapping. So Renee, could you respond to those three, please? Thank you. Did we lose Renee?
No, I'm still here. I was just muted. My apologies. Thank you.
No problem.
I'll start with the GIS question first. We actually ran a virtual facilitated GIS training course for COVID earlier in the year. It was a 6-week program that we ran in partnership with Esri, who are the leading ArcGIS organization, but that was facilitated, so that was with a limited audience. We're working with them now on a way to have self-directed courses available. They wouldn't be on OpenWHO. The OpenWHO courses are really about the WHO guidance, and it's a platform to go and get access to the latest in the recommendations on infection control, the clinical guidelines and things like that. It's less about some of the other technical tools. With the question with respect to radio tracking, I might need a little bit more context around what that is referring to. We have used radio as a really powerful education tool in the past. So either through podcasting or through daily radio programs on the same topic, every day adding onto the next chapter. That's been really powerful as well. And my apologies, Bernadette, the third question, I can't see it in the chat. I'm not sure which one it was.
Okay, thank you so much, Renee, for answering those. I see that you've been the lucky winner of the lottery when it comes to questions. So you can just look at the chat and maybe respond back to the people on the chat, Renee, as we're running short of time. And I think we need to move on because we promised everybody that we would not exceed over a certain time, and we'd like to keep everybody's attention. So thank you for the active participation. And if your questions haven't got answered, I would request panelists just to have a look at the chat and to respond to them in the chat. And with that, we end our Q&A session. And we go on to the next part of the webinar. And we're back to Professor Paul Alvani, and he's going to share with us his insights on strategies and framework for digital learning in global health and emergencies. And it's very interesting that this was one of the questions that came up in the chat. So Paul has a response to this. Over to you, Paul.
Thank you. Thank you very much, Bernadette, and thank you to all the speakers. Excellent points. And next slide, please. I love the SOCO single overriding communication objective, the obsolescence point that was made by Dr. Prasada Rao, the challenges and solutions by Bobo as well. So just picking up on some of those elements to give you, I'll be rather brief here, but respond to a couple of the questions that were raised. So this is an e-learning project that we're doing jointly with WHO GOARN, the Global Outbreak Alert Response Network across 11 countries in Southeast Asia. It's not just about training, but it's creating that platform for engagement, for communication, for collaboration, and for continuous learning. How do you take a situation where rapid knowledge and information needs to be designed, developed, and disseminated, and at the same time, its impact needs to be measured? That's what this project is. Next. This project, which is funded by USAID across 13 countries, this was in English, French, Portuguese. We didn't do this in Spanish. And it's basically, again, COVID-19, rapid design, development, and rollout of knowledge and information across these countries, which was jointly launched with the Ministry of Health of Philippines as an example. Next. Then the third example is with Global Fund funding through UNDP, working in English, French, Russian, and Spanish. More than 6,000, actually it's 10,000 students across 24 countries took the various courses over the last several years. We've been hosting, maintaining, and marketing these courses and platform, and often based on a niche area which doesn't exist. All of these courses are free of charge, designed to rapidly upskill people in these areas. Next. And the final example, which was also alluded to by Ruben, is the work that we've been doing in tuberculosis, funded by USAID in partnership with the union and various other organizations for the National TB program, and also working with Johnson & Johnson and others. So several examples, but now the question is, how do we create a framework around this? How do we think about e-learning? And at the beginning, I mentioned about how this fits in, how human resource capacity building and information are two of the 6 pillars of a health system. Next slide, please. So the question I was asked is, how do we design and develop a digital learning framework? How do we, what's the thought process? And so this is a strategic framework that we use and we share with our partner agencies. And it's a 6-step approach. And keeping in mind, any of this doesn't sit outside a public health system, but has to be sitting in and working with either a government system or an NGO that you're working with, or a UN system, but it must be part of the organization entity. So the first step is really about, which is the outer semicircle, looking at those 4 components, the understanding the healthcare system and the health workforce, the target user demographics, the implementation, really understanding who the target user is. Are they the doctors or the last mile workers? Are they well educated with 20 years of experience, or do they have barely a high school diploma in 6th grade pass, but are in the field working? So really understanding who it is that we are targeting and working with. How do you get the knowledge out there? Just by designing and developing e-learning, I guarantee you that the number of courses that have been designed and developed and are just sitting there with practically no traction, no one learning, are in hundreds of thousands. So implementation channels, how are you going to get the knowledge and information out there? And then the fourth part of the first section is really financing and sustainability. We absolutely need to review and study these before we start getting into the other steps. And the second one is then design digital learning strategy and architecture. What should it look like? And Bulbul gave a few examples. The work that we're doing with the National TB Program is another example. So must have that strategy and architecture in place before you start to jump into it. The third part is designing and developing the learning management platform. That's really a delivery channel. You can design and develop, but you need that delivery mode, and you need to understand what that is. Do you need to build it? Do you leverage an existing one? How do you get it out there? The third one is then to design and develop the content. You deliver it through various learning solutions to the target user, and then you measure the impact of learning. All of this is useless unless and until you're able to show that, in fact, what you're doing is actually achieving results. Next, please. And the question that was asked is, well, we know that one size doesn't fit all. Several points were raised by the individuals. And so we have a matrix that we look at on the y-axis, the vertical axis, what type of communication devices are the users using? What do they have? And on the x-axis is, do they have connectivity and electricity? And it's really looking at this matrix that gives you a sense of where and what type of e-learning we can create that we know will have an impact. So on the top right-hand side, assume it's strong and regular connectivity and electricity, and these individuals have computers or smartphones. That's usually urban settings, and we can pretty much create anything and everything. And Renee talked about gamified learning, and you can have augmented reality, and you can go all out in terms of creativity and innovation. But on the bottom left, where you have, let's say, deep rural, last mile, tribal areas, you have to be really, really minimal in what you create. Yes, you could potentially download stuff and work offline, and Bulbul gave some examples there as well. But it's really then thinking, what is it and how are we going to work? I'll show you an example of, let's say, if you're in deep rural, you want to leverage technology, but you don't have access to any devices. What do you do next? Next slide, please. So here's an example of what we are innovating and trying out with partners. It's a open digital classroom for the last mile. And if you look on the top right, there's a person with a backpack, bunch of tablet PCs with chargers and everything else. And so the trainer, the facilitator, the health worker, the last mile worker pretty much is a mobile trainer. He doesn't have to be an expert because all the content is in your tablet PCs. And this content can be easily updated. It can be adapted into any language. And you get that face-to-face, that blended approach, which was mentioned by several speakers as well. And you can take it to the real last mile, and not just last mile health workers. We're talking community themselves. We're talking about the beneficiaries themselves. And this is an area that we are in the process of innovating and trying out in India. Next. We don't have the time. I'm going to send you there's a video link actually at the bottom here. It's a 2-minute video link. And this is the platform that we are using with WHO CRO in GOARN, and also with 10 ministries of health across Africa and Asia. The platform, the delivery methodology cannot be all digital, as was mentioned by Igor and several speakers. Can't be physical. We are limited. We just can't do it. Whether it's by a pandemic or financially, or otherwise it's just not efficient, we can't scale. How do you bring the best of both, and how do we bring scale? And that's what this platform does. There's a knowledge section where all the content and resources are kept. That's with that learning and development with all the courses. And then for the technical assistance, you bring global experts, national experts, and we bring them to the platform either at scheduled intervals or on demand. And then all of this is structured in a way where you, the individual, controls your learning. You can reach out to anybody, anywhere. And that's what this particular platform is, with a few examples. We'll share the link with you. Next. Impact, impact, impact is a question we're asked first, even before we get started. How do we know if we're making any difference? And there's really 4 levels. So if you're going to do e-learning, or if you're going to do any program for that matter, the 4 levels that we take into account: did the learners enjoy the training? Did the learning actually, the learning transfer occur? Did they actually pick up the knowledge? Did it result in behavior change? And finally, did the training influence performance? And as you go even higher, did it have the necessary impact, outcome and impact as well? And all of this is captured in dashboards that are built into the learning platform. So if you're designing and developing learning platforms, please make sure that you've got these metrics available to you. Next, I believe it's the last slide. Yep. So I pause there. We just have a couple more minutes. Thank you for your patience. I know we're running late. It's the last one here. Thank you so much. Patty, over to you. Somebody might need to unmute.
Patty, are you with us?
Yes, sorry, I was muted. So thank you so much. And thank you for this excellent summary, highlighting the opportunities for the future for digital learning. So I just have a couple of points to summarize and take home messages from this exciting webinar. So I have sort of, listening to all those speakers, I have highlighted 5 points which I think we should take home. One of the things is digital public health is absolutely interdisciplinary. There is no way a single discipline, single institution can bring a lasting general solution. So we really have to work on strengthening our collaboration, both at the local level, country level, international level, and of course in collaboration with the UN agencies. Secondly, capacity building and training has got immense opportunity to utilize the digital technologies. And this webinar was really highlighting how we have moved on in training in comparison to 10 or 20 years ago. However, it also became apparent, and I think we all experiencing it in the lockdowns in 2020 COVID-19 crisis, how face-to-face learning and the human communication cannot be completely abandoned and moved away from. We really have to look at what can be effectively delivered online, digitally, and where perhaps the traditional face-to-face learning, traditional physical conference gatherings, and training, on hands-on training is still needed and is still beneficial to not just transfer the skills, but also communicate and enable the social and networking links. It was exciting to see Paul's presenting this framework with the acces, taking us through different ways of looking at training. I've also done 2 acces to add to his framework. While there's a tremendous opportunity to do webinars and online education like this, where we can log in for 5 different continents and share our knowledge in a couple of hours in a way it would be impossible if this was organized as a face-to-face conference, we also have to look at, we also need to change our knowledge and enhance our understanding and behavior change at the point of care. So seeing the whole spectrum where there's a patient in front of you and you need to make the right choice using the latest evidence and enhance the delivery of the care all the way to this high scale, flashy international webinar is where the big spectrum of one of the axes is. On the second axis, and it became clear from the WHO presentation, René was discussing the local needs and the country needs. So really understanding that something very specific, customized to local needs in an African country has to be developed and supported, all the ways to discussing how we can better integrate the CPD system, how we can recognize qualifications between different institutions, different countries, and different agencies. So the competency framework from the global level needs to strengthen the recognition of the skills, but all the way down through the tunnel, we also need to understand there could be specific local needs at a local level that also needs to be met using technology or using support for capacity building in face-to-face. My third point is looking at the global south. So many of us in this webinar are from the global south. We really have to shift our thinking where the collaboration has been historically centered in the global north. And the collaboration with the south was around data collection, for example. We really have to work in much more closer partnerships, in equitable partnerships between the global south and the global north, so as the needs in the global south are better met. And finally, we are in the middle of emergency, and a lot of the talks were centered around how we deliver emergency solutions, how we utilize social media and big data for early warning and response. But I think after the COVID crisis phase, we really have to hit the ground running and understand that capacity building through digital training will set the scene and prepare us and the healthcare systems globally for the next pandemics. Operating in an emergency is doing last-minute decisions and quick solutions to address the crisis. But we have to think about the next crisis and the time to prepare for the next crisis through capacity building, IT investments, infrastructure development, better collaboration internationally and nationally. This will be the message we have to take home and have to press the funders and the donors to invest into after the COVID, so as we won't be as caught unprepared for the next emergency. Thank you very much.
Thank you so much, Patty. That was a really challenging job to try and summarize the insights and the experiences, everything in a very short time. Greatly appreciate that. And I'm sure all the participants also appreciate it very much, these take-home messages. And now, dear colleagues and friends, we're into the last segment. Can I please have the poll so that everybody can begin to answer the poll? Please answer the last poll. It's a very important poll for us, both in terms of summarizing this particular seminar, but a webinar, but also in terms of future digital learning with Empower and with UCL. So please, it'll just take you 2 minutes to do this, fill out this poll. And while you're doing the polling, may I just thank the participants for their active participation, because the success of any webinar is not only how good the panel is and the excellent presentation, but it's also the feedback and participation from the participants. And we've had some really excellent comments, really a lot of thank yous and kudos to the panelists. So I hope all the panelists are going to take all the thank yous and kudos with them. It seems that most questions were answered, some questions were raised. So we hope that this will be a continued collaboration with those who participated and with the panelists. Do we have the poll ready now? Can we have a look at the poll?
We have 60% completed, just another 30 seconds to go till we get past 7. Yeah, still polling, it's ongoing, nearly there.
Okay,
15 more seconds.
Nearly there. Then I'll be giving you information as you continue to poll. Many of you have asked about the presentations. The presentations and the webinar recording will be sent to you by email. And therefore, it's very important at the end of this that there will be a link for the certificate, that you respond to that link so that your email is registered. And then you will get all these presentations as well as the webinar recordings. Please don't forget to do that. And I think Rahul and Preksha have been putting out this information on the chat to everybody. So go back to the chat if you're unsure about what needs to be done. The other group that I really need to thank is the Empower team that has put together, under the leadership of the director, the graphic.
We lost Bernadette.
The
We've
polls,
lost you.
the
Back.
logistics. Am I back? So it was
Yes,
just
you're
saying
back.
thank you,
Please continue.
thank you to the Empower technical team, and of course a very, very big thank you to all the speakers. And this webinar would not be what it has been without all our speakers today. So a big thank you and a big applause once again to all the speakers. So thank you very much. And if we can have the poll now to see how we fared. Okay, so we see that 100% are interested in receiving more information about digital learning, and they're forwarded by a friend, partner organizations. That's very good. And we've seen that people have taken both face-to-face courses at Empower, certificate and diploma courses. And this is really good to see that. Not yet, but I'm interested. So we're looking forward to all of you coming back and taking those courses. And the same with UCL. So lots of people wanting to take courses. That will be very good. And of course, it pleases everybody who's participated and contributed that the webinar, 97% found this useful. And those who found it somewhat useful, we'd really like to learn from you how to improve. So if we can close the poll, and then over to you, Paul, to end the webinar.
Great. Wonderful. Bernadette, always enjoy your style of moderation. Excellent. Thank you so much. We've covered everything. We are significantly late by about 25 minutes, but let's say 15 minutes because we started late. So my thank you as well to, of course, my team who've been at it to make sure everything is working, but to all the speakers and participants. I won't go into any more detail. You can all get your certificates. I believe there's one last step. Team, let me just, what do they need to do to get their certificates? Will it be automatically sent to them? Do they have to click on anything? If you can just post that on the chat. It is a certificate of participation as well. And there are a few other questions that were not answered. We will reply to you by email. So don't feel like we've ignored them. We've counted them as well. So thank you very much.
Thank you.
Really appreciate it. All the best.
Thank you, everybody.
Thank you.
Thank you.
Thank you.